Japanese encephalitis JE risk. The numbers and the changing landscape of JE risk. Welcome to an educational mini-module series on Japanese encephalitis, or JE. These are intended to take only a few minutes to review. In this module, we will discuss the risk of Japanese encephalitis overall and to travelers to Asia. The Centers for Disease Control and Prevention, or CDC, states that approximately 10% of the susceptible native population in JE endemic areas may be infected with the JE virus each year. Most of these infections are asymptomatic. However, approximately 1%, within a broad range from 10% to 0.3%, will develop a flu-like illness as a result of the infection, and less than 1% of those with a flu-like illness will develop Japanese encephalitis. The generally accepted overall incidence of JE is about 1.8 cases per 100,000 population, but this can vary substantially by year and location. For example, in children younger than 15 years of age, the incidence is estimated to be 5.4 cases per 100,000. Before the introduction of vaccination programs, the highest risk areas in Asia had incidence rates of laboratory-confirmed JE as high as 20 cases per 100,000 per year. Since JE is transmitted by mosquitoes and not from person to person, it is important to remember that routine vaccination programs do not protect the unvaccinated traveler through herd immunity. In fact, the unvaccinated traveler may have a risk similar to unvaccinated children who live in JE endemic areas. The risk of JE is fluid. Both patient considerations and environmental considerations appear to play an important role in the uncertainty of JE risk. Let's look more closely at evolving risk. Both older and younger age place travelers at increased JE risk. For adults greater than 50 years of age, risk of neuroinvasive illness may be 5 to 10 times higher than for older children and younger adults. And the literature suggests that younger children appear to have a higher frequency of neurologic sequelae. Immunodeficient travelers, such as those with solid organ transplants or those with certain chronic conditions such as diabetes mellitus, cardiovascular, or renal disease, also may be at increased risk because immunodeficiency has been associated with an increased risk of neurologic infections from other flaviviruses, such as West Nile virus. JE may pose an additional risk in pregnant women. One study carried out during an epidemic found that 2 of 5 pregnant women infected with JE virus aborted, and JE virus was found in the aborted fetuses. If your female traveler is trying to become pregnant, it is important to discuss mosquito-borne illness. For environmental considerations, the impact of climate is generally unclear, but there is concern about the impact on mosquito populations and altering or extending JE transmission season. As we discussed in the module on JE virus, there is increasing evidence of peri-urban and urban transmission. Modernization is blurring the lines between urban and rural areas, and recent cases of JE have occurred in travelers to resorts and peri-urban areas. What is the risk to JE in travelers to Asia? For an individual traveler, JE risk is highly variable and depends on factors that increase or decrease exposure to mosquitoes carrying Japanese encephalitis virus. These factors include travel season, location, duration, accommodation, and activities. The bottom line is unvaccinated travelers are vulnerable to infection with JE virus, and their risk may be comparable to that of the resident population, which we discussed earlier in this mini-module. However, let's look a little more closely at the traveler's risk. Risk is low for travelers with very low-risk itineraries. These are shorter-term travelers to urban areas who travel outside of the JE virus transmission season. As an example, this would include the business traveler who stays in an urban setting in a modern hotel during a short trip to Asia. Risk increases as exposure to JE virus increases. For travelers with high-risk itineraries, like rural areas, the CDC estimates that JE risk may be as high as 1 in 5,000 per month. In the module entitled The 3 O's of JE Vaccination, we will discuss in more detail specific factors that raise JE risk. Thanks for listening. Please find additional educational mini-modules about JE and its prevention, along with other resources for clinicians and travelers, on www.preventje.com.